My name is Michael Cutrer. I'm a neurologist at the Mayo Clinic. I specialize in headache disorders, and I take care of a lot of people who have migraine. I'm very interested in understanding how migraine happens and how we might better treat it, because a large percentage of the patients that I take care of suffer a great deal from this disorder. I also have to admit that part of the reason that I'm particularly interested in this disorder is because I have it myself. I first began to have migraine when I was about 14 years old. Until that time I had had really no health problems. I didn't have any symptoms of neurologic disease or anything. And I remember pretty clearly one afternoon in August, I was watching television with my brother, and all of a sudden I couldn't see part of Gilligan's face on Gilligan's Island. I didn't know what to think. I stood up, walked around, looked at my hand, walked outside, but I continued to not be able to see part of things that were in front of me. Parts of trees were gone. I would hold my hand up and look around. I couldn't see that. I went back in the house and laid down on my bed, thinking, oh, well, now you've got your brain tumor. I had seen all the medical shows, Marcus Welby reruns, and anybody who had this kind of a symptom always had something horrible, and I thought I did too. After the visual symptoms passed, I got numb on half of my face and moved down my arm. This convinced me even further. I then had a horrendous headache. I threw up several times and was sick most of the afternoon. I was so frightened by this that I kept it a secret for several months. I had several attacks before I finally told my parents about it, because I didn't want to be taken to the doctor and get that CT scan and find out that I had a brain tumor. But finally went to the doctor, and the doctor told me that it was all caused by a reaction to an aspirin I'd taken for the headache. Well, it didn't prove to be that. And it was only after I saw several doctors that I found out that I had migraine. And throughout the rest of high school and college and my 20s, I was plagued by these recurrent episodes of being really sick, usually preceded by not being able to see. The attacks were so devastating that I began to avoid things, avoid situations that I had thought any chance of producing an attack. I was afraid to talk about it because they were so horrendous. My attacks would last 8 to 12 hours. I would throw up until I couldn't throw up anymore, and then I would retch. It was a very bad time. And what made it worse was I would go to the doctors, and they would look at me in a perplexed way and never really give me an answer, and the treatments they gave me didn't work. This continued on, and I really didn't get control of my own headaches until I was in my residency in neurology. It's kind of a shame that that would be true, because migraine is so common. It affects about 38 million people in the United States today. Just to sort of give you a context for that, that makes it more common than diabetes and asthma combined. Yet despite that, doctors and even neurologists don't always do a good job, and very often they really don't want to hear about it. And I guess there are a lot of reasons for that. We really don't understand how it happens, and we don't have great treatments, and the treatments we do have don't work in everybody. And we really don't have a good way to tell what patient is going to respond to a particular treatment. So we sort of randomly throw these treatments, one after another, to a patient until we find something that works. It's usually not very satisfactory for the patient, and it's often not very satisfactory for the physician.